Video is on dizziness. We'll explore the main causes of dizziness, adopting a systematic approach. We will also talk about why you may suspect one cause over another. So to clarify the definition of dizziness, we will talk about pre-syncope or feeling faint. There are cardiac and neurological causes. We'll start off by talking about the cardiac causes. Commonly, this is due to orthostatic hypotension, or commonly known as postural hypotension. So when you sit up, they may feel dizzy. This is commonly due to drugs such as antihypertensives, especially diuretics. Antipsychotics is also another possible medication, as well as alcohol. Hypovolemia is another cause, and this could be due to gastrointestinal bleed, diarrhea, or vomiting. And this is suspected if when you take the blood pressure, there's a narrow pulse pressure, so reduced systolic and maybe an increase of similar diastolic pressure. And this is due to reduced cardiac output, so reduced systolic, and then increased total peripheral resistance to compensate, leading to a similar or increased diastolic pressure. Another cause is primary autonomic failure, and this can be due to Parkinson's disease or Lewy body disease. Now, you could argue this is more of a neurological cause, but it does cause orthostatic hypotension, so that's why we're talking about it under cardiac. Secondary autonomic failure is also possible due to diabetes. There's a complication of diabetes of neuropathy affecting the autonomic system, as well as uremia, possibly secondary to chronic kidney disease. There may also be arrhythmia, so if the heart isn't pumping properly, you won't be getting out enough blood, and that's why you may feel dizzy. This could be due to the heart pumping too quickly, such as in the case of tachyarrhythmias, commonly atrial fibrillation and atrial flutter shown in this ECG, such as irregular tachycardia, no P waves, and the atrial flutter has the iconic sawtooth appearance. It may also be due to supraventricular or ventricular tachycardia, and this is a fancy way of saying tachycardia. So basically it could be tachycardia in the ventricle, or it could be above or supra to the ventricle, whether it be in the atrium or the atrioventricular junction. Or the heart may be pumping too slowly to meet the body's demands. This is commonly due to family history of sudden cardiac death and will often first present in younger patients. They may have focal channelopathies or cardiomyopathies, specifically long QT syndrome if there's hypocalcemia or issues with the calcium channels. There may also be structural causes of dizziness. This could be due to the valve of the heart, so aortic stenosis in an older patient, increased calcification. You may hear a murmur radiating to the carotids, or in mitral regurgitation. Structures could also be talking about the heart muscle, as shown in this diagram, where there's congenital hypertrophic cardiomyopathy, so a thickened intraventricular septum, more muscle, but this also means the outflow is now not dissimilar to aortic stenosis. There may also be tumors, so atrial myxoma shown in the echocardiogram, in this case a left atrial myxoma. You can also have constrictive pericarditis. There are also neurological causes of dizziness. In younger patients, vasovagal, and that's maybe the most stereotypical faint. You get stressed, you feel like passing out. You see blood, you feel like passing out. It could also be due to certain situations, situational syncope, and this is due to increased parasympathetic activity, for example, post-urination, post-defecation, or cough. The final neurological cause is carotid hypersensitivity, and this can be triggered by shaving or wearing a shirt with a tight collar, but also often patients won't know that this is a thing, so you'll get a very, very non-specific history. Finally, metabolic causes, so exclude any hypoglycemia, low sugar levels. For example, if the patient has diabetes and has taken too much of their medications, or they have had a recent medication change. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.